Hello, I'm Dr. Ajay Naik, cardiac electrophysiologist at SIMS Hospital, Ahmedabad. I'm an arrhythmia and heart failure management specialist. Fainting is a fairly common phenomenon, and in medical parlance, it's called syncope. In the vast majority of cases, people faint and wake up, and generally there is no problem. But in some cases, fainting can be fatal. And we have to find out what the problem is. Why is the patient fainted? Because this could be the first sign of impending doom. Fainting or syncope can be a harbinger of sudden death. Now, fainting or syncope, as we call it is generally of rapid onset, quick recovery, and spontaneous recovery. So, a person doesn't need to be given injectable medications for recovery, etc. So, rapid onset, short duration, and spontaneous recovery of consciousness defines syncope. The causes of syncope or fainting are many. Some may be due to cardiac causes, that is heart related. Some may be due to neurological causes, that is brain related. Some may be due to a communication between the two. Some are called reflex syncope. Or some could be due to something called orthostatic hypotension. Now, these are various causes which can cause syncope, and we'll deal with a few common ones in this today's session. The most important is cardiac syncope, which we should not miss out because cardiac syncope can cause sudden death. So, if a person has syncope today and the cause is due to some heart condition, this is a chance that God has given us to find out the problem because we may not get a second chance. Three major causes of fainting or syncope are one, reflex syncope, second is orthostatic hypotension, and third is cardiac syncope. Now, these are medical terminologies, but we'll quickly walk through it. So, the first, reflex syncope, is a common faint that people can have. If there is severe pain or a sudden injury, or you are seeing a bad sight, or there is a sudden loud noise and a person gets frightened, at that time, suddenly there may be a loss of consciousness, the person falls down. But within a few seconds or half a minute, the person will get up and is feeling all right after that. This can also happen if children, they're going to school, they're standing in the assembly line, it's very hot, and somebody gets a little dizziness and falls down. But the children recover again, and then there is no problem. This could occur in adulthood also. The other cause of this type of syncope is like a soldier's faint. You're standing in attention for a long time, you're not moving at all, the entire blood gets pooled in the legs, the brain doesn't get blood supply, and a person gets dizzy and falls down. But the moment the person is flat, the brain starts getting blood supply, and then the person wakes up again. So, this is vasovagal or reflex syncope. It's the common faint. Generally, it will not cause any lasting problems, and you get a few seconds to hold on to something and to prevent injury to yourself. The second type of syncope or fainting is due to orthostatic hypotension. This is often seen in the elderly or people who are diabetic or on medications or they have other diseases like Parkinsonism. There is general degeneration of the nervous system. And in these people, when they are getting up from the lying down position, again, the blood pressure drops, the brain doesn't get blood supply, and a person can get dizzy and fall down. Again, the chances of injury are there, and we need to support this. The third cause of syncope is ominous, and that is cardiac syncope. The first two will generally by themselves not be fatal, but a cardiac syncope can be fatal. And again, the causes could be multiple. It could be abnormal rhythm of the heart. When there is bradycardia, the heart rate has dropped down severely. If there is problem of the switch or junction box of the heart, the sinus node or AV node, and the heart rate drops to less than 30, Or if there is tachycardia, the heart rate has jumped to 200, 250 beats per minute. It is due to abnormal rhythm coming from the upper or lower chamber of the heart, which are ventricular arrhythmias, that can cause sudden cardiac death. There are certain other problems which can give rise to syncope originating from the heart. If the patient has certain structural disease of the heart, if there is a valve disease, if there is a tumor in the heart, or if there is pulmonary embolism, the clot formation occurring in the leg veins, which travels to the heart and lung arteries, that can cause syncope and it can cause sudden cardiac death. So these are the various causes of syncope. Just recapitulating, the common are reflex or vasovagal syncope. Very common, generally not fatal. Second is orthostatic hypertension, generally seen in the elderly. And third, the ominous cardiac syncope. The treatment of each is different, and we need to individualize. We need to get to the bottom of the problem. The first two can be treated with lifestyle and behavioral changes, drinking plenty of fluids, if possible, take slightly excess salt, avoid prolonged standing, or if you need to do certain postural exercises like ankle or knee flexion, avoid sudden standing, avoiding prolonged standing. Yoga exercise improves the reflexes and prevents these problems from happening. Certain medications would also help in preventing this type of fainting. Cardiac syncope needs to be managed differently. Apart from lifestyle changes, medications, uh, we need to do certain other procedures to prevent further episodes of syncope. And this may include EP study ablation for tachyarrhythmias. It may require a pacemaker implantation for bradyarrhythmias. There may be requirement of a defibrillator implantation, or certain patients who have structural heart disease may require surgery. So, syncope, like I said, or fainting, is a symptom of underlying heart disease, reflex problem, and it needs to be diagnosed and treated by individualized management. This is Dr. Ajay Naik, cardiac electrophysiologist at SIMS Hospital, Ahmedabad. And in this series of arrhythmia and heart failure management, we'll be dealing with more such common problems and the way to treat it will be discussed. Take care of yourself and your significant others. Be healthy, stay safe.